What if I told you that diabetes is not always a lifelong disease? What if something as simple as a handful of nuts could reduce blood sugar spikes, lower insulin resistance, and even start reversing diabetes?
Viewers, until recently, and for a very long time, it was believed that once diabetes develops, once blood sugar appears, it cannot be properly controlled and becomes a lifelong disease. Now, diabetes has multiple aspects. One of them is the glucose spike, meaning a sudden rise in blood glucose after consuming a carbohydrate-rich diet. Controlling fasting glucose has also remained a major challenge. In addition, there are many other problems that arise due to high glucose or diabetes. Therefore, foods containing carbohydrates were always targeted. The approach was to reduce carbohydrate intake, but along with that, a very difficult question remained. How do we control the absorption of glucose in the body? Various techniques were used to control glucose intake as well as its absorption. One major aspect was fatty liver, which is a result of insulin resistance. To control fatty liver, weight reduction was considered extremely important. Along with this, various vegetables like bottle gourd, bitter gourd, and fenugreek were commonly used. It was also observed that if fiber is consumed properly, insulin resistance shows some improvement. In addition, husks, pulses, and various fats and proteins were used in an attempt to blunt the insulin spike. Some of these techniques were successful, some were not. However, one important category that was largely ignored was nuts, also known as seeds or kernels. Among the most important nuts are peanuts, almonds, and walnuts. It has been observed that these three nuts contain all three essential components: healthy fats, protein, fiber. These three components reduce insulin spikes, decrease insulin resistance, and significantly lower glucose spikes. They also have many additional benefits, including increasing insulin sensitivity.
First nut we will discuss is peanuts. Peanuts contain several beneficial compounds, especially oleic acid, which is amino acids.
Oleic acid, which is a monounsaturated fatty acid. The mode of action of monounsaturated fatty acids is that they reduce insulin resistance. In addition, peanuts enhance insulin signaling in various tissues, such as muscles, the brain, and the liver. This reduces lipotoxicity, a condition in which excess fat accumulates in different parts of the body because mitochondria, the energy powerhouses of our cells, are unable to fully utilize fat. Oleic acid eliminates this toxicity, which leads to reduced insulin resistance, improved insulin signaling, and decreased inflammation. Inflammatory markers such as TNF-alpha, IL-6, and CRP are reduced, thereby increasing insulin sensitivity. Peanuts also contain numerous antioxidants and polyphenols, which reduce oxidative waste produced by oxidation reactions in the body. In muscles, peanuts increase GLUT4, glucose transporter 4 activity, enhancing glucose uptake into muscles and thereby reducing blood sugar levels. Peanuts are rich in vitamins and minerals, including magnesium, phosphorus, copper, manganese, zinc, and vitamin E. These nutrients increase insulin production, improve insulin sensitivity, and act as antioxidants. Peanuts activate AMP kinase, a metabolic switch inside mitochondria, which improves the utilization of vitamins, minerals, fats, and glucose for energy production. This corrects metabolic dysfunction and initiates the reversal of diabetes. As a result, sugar cravings decrease by 35%. Glucose spikes reduce by 32%. Insulin demand decreases by 22%. Another very important action of peanuts is that they slow gastric emptying. Hormones like GLP-1 and PYY increase, causing slower glucose absorption, improved insulin sensitivity, reduced LDL oxidation, increased HDL cholesterol, improved arterial elasticity, and cleaner blood vessels. This improves heart and brain health. Increased insulin sensitivity in the brain enhances thinking and cognitive ability. Recommended dose: do not consume more than 1 ounce, 25 to 30 peanuts. Best time: 10 to 15 minutes before lunch. 1 ounce contains approximately 165 to 170 calories, so excess intake should be avoided. Peanuts reduce HbA1c by up to 2% and significantly help with weight control.
The second powerful nut is walnuts. Walnuts are rich in omega-3 fatty acids.
Walnuts reduce appetite by improving leptin sensitivity, lower fasting glucose, reduce cortisol, and decrease sugar cravings by 30%. They reduce HbA1c by 2.5% and suppress ghrelin, the hunger hormone. Walnuts significantly improve brain insulin signaling, enhance energy production in the brain, reduce triglycerides, lower oxidized LDL, and protect heart and brain health. They are rich in plant protein, omega-3 fats, and fiber, which produces short-chain fatty acids, improving insulin sensitivity and metabolic health. Best way to consume: soak walnuts during the day or overnight and consume 4 to 5 pieces at night. Soaking removes anti-nutrients like phytates. 1 ounce contains about 165 calories, so moderation is essential.
Third powerful nut is almonds. Almonds are well known for supporting brain function and appetite control.
They contain monounsaturated fatty acids, particularly linoleic acid, which reduces fatty liver, removes excess fat from muscles, improves insulin signaling, reduces glucose spikes. Almonds have a glycemic index of 0 and glycemic load of 0, making them ideal for people with diabetes. They are rich in polyphenols, antioxidants, vitamins, and minerals, including vitamin E, magnesium, riboflavin, calcium, potassium, phosphorus, copper, manganese. Almonds activate AMP kinase, improve mitochondrial function, increase energy production, reduce insulin resistance, lower oxidative stress, reduce LDL cholesterol, and increase HDL cholesterol. They enhance GLUT4 activity in muscles, allowing better glucose utilization and preventing post-meal sugar spikes. Recommended intake: consume 20 to 25 almonds, 1 ounce per day. Soak overnight, peel, and eat in the morning. Almonds are excellent for mental focus, stress reduction, and brain health. Nuts work through multiple mechanisms: reduce insulin resistance, improve insulin sensitivity, blunt glucose spikes, reduce chronic inflammation, protect and strengthen beta cells, increase GLP-1 hormone, slow gastric emptying, reduce appetite and body weight, improve fatty liver. For individuals who want to lose weight, control fatty liver, or reverse diabetes, peanuts, walnuts, and almonds are powerful and practical dietary tools.
If you found today's video helpful, please like and share it so others can benefit. If this is your first time watching, subscribe to the channel. Many valuable health videos are coming your way. Thank you for watching. Stay healthy.